Welcome to the Western North Carolina School of Massage. Today we're learning the neuromuscular massage therapy protocols for treating the posterior lower leg. We're going to be focusing on the gastrocnemius and the soleus muscle. We'll begin with our client in a prone position, laying face down on the table. We're going to undrape the lower leg. And we're going to use a bolster underneath the ankle. There we go. To allow the foot to rest in a neutral position. We're going to use some Dysum, which are gripping material, to help us facilitate a myofascial stretch. We will apply the Dysum as a non-slip surface here and here, and apply a cross-arm myofascial stretch that will hold for at least 1 full minute. We're going to repeat this step in 1 to 3 areas along the entire posterior leg. Our intention here is to soften the surrounding fascia and to create some localized blood flow and redness. This is one of our warming techniques. After we spent 1 to 3 minutes doing some myofascial stretching, we'll continue with some warm-up techniques, all done dry. Next will be our skin rolling. This may be a little bit tender at first, and communicate with your partner or your client about their comfort level. All the way down. Until we reach the area of the Achilles tendon. Once we've completed the warm-up series, we're going to move in to applying some lubricant to the entire lower extremity with some gentle, broad effleurage. We'll return to the calcaneus, where we'll do some circles around the heel using our thenar eminence 3 to 6 times. some flat compression along the Achilles tendon, where we'll hold for about 10 to 15 seconds. And linear friction. We're going to use our thumbs, 2 thumbs, to apply deep stripping effleurage to the entire muscle belly of the gastrocnemius. And we're going to do this to our client's comfort. So we would like to check in with them periodically and ask if they would like a little bit more or a little bit less pressure. Would you like a little bit more or less pressure?
A little more.
Sure. Will you let me know when it feels better? And does that mean it feels good?
That is good.
Good. So our deep stripping effleurage is done slowly, with strokes moving from origin to insertion. So we'll repeat this about 4 to 5 times. Here we're also assessing for trigger points, where we'll go back and work in just a few minutes. You can use a hand over hand technique as well, with the emphasis of pressure on your fingertips. Noticing any areas that feel taut, any taut bands or trigger points that may or may not refer pain. Is this an area that's a little bit tender right through here?
Yeah, very much. And I can feel it in the front of my knee.
Okay, so be aware of some pain referral symptoms. Would you like a little bit more or less pressure here?
That's good pressure.
Okay, will you let me know when that lets up? Starts to feel better. Let's have you take a few nice deep breaths. Feel like it's starting to let up a little bit.
Yeah.
As soon as it starts to release, we're going to use some gentle friction at the same depth of pressure that we've been compressing to smooth out those muscle fibers. And then back to some deep stripping effleurage again. Alright, we're going to repeat the same steps to the lateral belly of the gastrocnemius 5 to 7 times. Paying attention to what we're feeling under our fingers. You can use a combination of thumbs and fingers. Even knuckles. Don't wear out just one tool while you're doing neuromuscular therapy. Is that a tender spot there?
Mm-hmm.
Would you like a little bit more or less pressure?
That's perfect.
Will you let me know when that feels a little bit better? Taking nice deep breaths.
Yeah.
Good.
Oh,
Some
yeah.
friction. Alright, we're going to repeat the same thing to the medial side. On the inside belly of the gastrocnemius. You can use thumbs or fingertips in the belly of the gastrocnemius. You let me know if I come upon a tender spot right there. Okay, so we're going to hold a static compression there. You let me know when it gets to a mild discomfort.
Oh yeah.
Yeah, you want a little bit more or less?
That's great.
Okay, we're going to hold it right there. And let me know whenever that starts to let up. Do you feel that anywhere other than that spot? Is it referring up or down anywhere?
I feel it in my knee.
In her knee. That's a common place where we feel trigger points from the gastrocnemius. Alright, and friction. Alright, so we're going to return back down to the heel. And this time we're going to take out the bolster. And we're going to support the leg with our knee, supporting the ankle joint here, allowing the foot to rest in a neutral position. We are going to create some pincer compression at the Achilles tendon. We want to offset our thumbs just a little bit as we hold for about 10 seconds. And friction. We'll slide up a little bit and do the same thing. And friction. And slide up. And friction. About as far as we can pincer compress and isolate the Achilles tendon before it turns into muscle belly, which will be about right here on her. All right, so once we've done that, we are going to abduct the legs ever so slightly, redraping, allowing the foot to fall off the side of the table. We're going to use our thigh against their neutral foot in a lunge stance. And we're going to do some effleurage in between the septum of the bellies of the gastrocnemius, in between the area that separates the bellies of the gastrocnemius. So as we glide, we're going to allow our foot to deepen into a lunge. We're going to move nice and slow. And we're going to pull and separate those two bellies of the muscle in this position. Making sure we stay in good communication with our client.
Oh, I can feel that.
Would you like a little bit more or less?
That is perfect.
Good. If you'll tell me if we cross over the edge to where it feels like it's beyond a mild discomfort.
Whoa, I felt that in my upper back.
Did you feel it in your around your sacrum at all? Or was it up in the shoulder area?
It went straight up to my shoulders.
Interesting. People have all sorts of interesting responses to that work there. But a lot of back pain comes from here as well. So in the same position, we're going to run along the edge of the gastrocnemius to where we are palpating soleus. You can use your fingertips. You can actually visibly see when this muscle is at rest. If we pull it up a little bit and create some slack in the muscle, you can actually see where we can pick up the gastrocnemius, and right underneath it, and that edge, is the soleus. So we're going to follow this line from the Achilles tendon underneath the gastrocnemius. We're going to run right along the edge of the soleus. And this can be really tender on folks, so will you please let me know if it goes beyond a mild discomfort. Is that a tender spot through there?
It is, and it feels very good to have pressure on it.
Good. We'll take a few seconds where we're going to hold that. Have you take a nice deep breath. And exhale. You let me know when it starts to let up a little bit. Good, and we'll do some gentle friction.
Yeah. That feels better.
Good, and we'll continue on. About 3 to 5 times. I'm not going to go through this that many times, but with our client, we want to find any areas of tension, any taut bands, any trigger points. Treat those areas, friction out, and then effleurage again. We're going to do the same thing on the other side. We won't be able to go all the way up on this side because, is that a little bit tender there?
Yeah.
Do you like more or less pressure?
Yeah.
About right like that?
Yeah.
Okay, good. We found a spot right away on this side. This side's often very tender, so common trigger points are in this area. A little friction. And tender.
Yeah, in a good way.
Good. And hold. At any point in time it becomes too much for your thumbs, switch tools. Don't overwork your thumbs in NMT. You can also use tools. And flush these guys out with some more deep stripping effleurage. We're going to bring the leg up and allow the leg to rest on our shoulder for some petrissage to the entire lower leg. This allows you to really pick up that gastrocnemius. You can do some twerking. And you can also do some other gentle effleurage to smooth out and make nice from all that work that we've just done. And we're going to support their leg again with our leg, and we're going to pincer compress each one of the bellies of gastrocnemius. Pincer compress and pull. Pincer compress. And pull. We'll find a couple of different spots where we can find some trigger points here. Would you like a little bit more or less pressure?
You can do more.
Sure. So even though it looks like a lot, is that good there? Good. Clients can often withstand a bit of pressure. There we go. And making nice to smooth out after all that good work. You can make nice with Effleurage and Petrissage. I'm going to bring the leg up to a 90-degree angle. We're going to cup the heel with our hand and lunge down, stretching the soleus. This is a soleus stretch because the knee is bent. We cannot fully stretch the gastrocnemius in this position because the gastrocnemius crosses the knee joint. We'll hold this for about 20 to 30 seconds. And back up to neutral. Mobilizing the ankle joint in all directions. Coming into a dynamic motion where we compress into the plantar fascia and stretch, dorsiflexion stretch, moving and pulling back into plantar flexion, compress and stretch, moving back into plantar flexion, and a rhythmic motion. We call this the foot waterfall. It's a nice fluid motion. Loosens up the ankle joint and all the little muscles of the plantar surface of the foot. And relax. And spending just a few moments to make nice to the entire lower extremity. Doing some nice soothing effleurage to the entire posterior lower extremity. And that's it. Redrape her leg. And I'm willing to bet she feels much better. Thank you.